not going to go into a lot about secondary influencing factors, but when you look at certain studies on caries, they look at specific populations of people, they look at ethnic groups, they look at occupations. All these things come up when they do caries studies. Now, what's interesting is kind of at a population level, a lot of these things do have certain trends. We do typically see caries more in like population groups that are lower income than we do in higher income individuals. But that's not a blanket statement or a blanket rule for everybody, right? It doesn't mean because you don't make a lot of money that you're going to get a cavity, because that's just not the case, right? So at a population level, a lot of these secondary influencing factors, they do show trends, but at an individual, at a patient level, that's not necessarily going to be the case 100% of the time. So the last thing I want to mention in this specific segment is, specific considerations for children, right? Specifically children under the age of 6, because, just being a young child, they have their own set of, influencing factors that contribute to their ability to have dental caries. Now, one of the big things is their caregiver, right? The person who's actually taking care of them on a regular basis. This could be their mom, this could be their dad, this could be a babysitter or a daycare worker. If they're around somebody on a regular basis that's kind of up in their face, as a dad, I know I've been guilty many times when my girls were very young. You do certain things, you're spreading germs, right? Caries is a disease process. It's a bacterial disease process. And so you're not born with that bacteria. It just doesn't happen. You actually acquire it, right? You acquire it typically from your primary caregiver. So that's a huge factor is what's the caries status or the activity of the person who's actually seeing that child on a regular basis. If they're high caries risk, well, there's enough suspicion or enough worry that their child's also going to be high caries risk, because they're probably going to acquire some of that bad cariogenic bacteria from their caregiver. Another thing that kind of factors in there is the child's feeding schedule, right? How often they're actually feeding, what their diet consists of. If they're drinking, carbohydrate rich, formulas or milk or anything like that on a regular basis, or food on a regular basis, again, same rules apply, right? If they have cariogenic biofilm present and they're frequently feeding on something that feeds that bacteria, then they're going to potentially be at a higher risk for developing caries. Another big one that frequently comes up is just, putting the child to bed with a bottle or with a sippy cup with, apple juice in it, or some type of juice that's just full of sugar, full of sucrose. Those kind of things, when it's just bathing the teeth constantly, and a child that's going to bed, they have this thing, they're probably sipping on it throughout the night. That's a huge issue, a huge red flag that could contribute to that child having caries. And the last thing that really a big factor or big consideration for children under the age of 6 is unsupervised brushing, right? If a child, I almost would say up to the age of 8, they need to have supervised brushing. Just because a child can hold a toothbrush and move it around a little bit does not mean they're doing a great job at cleaning their teeth. So as a parent, and even as a dentist, we need to educate the parents to properly teach the child to brush their teeth. But even if they're doing a pretty good job brushing their teeth, we should still go back in there and brush their teeth a little bit better for a period of time, at least until we're confident that they're doing an adequate job unsupervised.